To viewers out there, I need you to know, I see a lot of patients that come to me and they say, Doc, inini BP yangu ndinoinzwa yakwira. That's not true. Especially amongst black patients, it's been proven that it's one of the best first-line drugs for blacks who are hypertensive.
Hello and welcome. This is the Med Talk brought to you by COSFA. So annually on the 17th of May, this is the day when the world commemorates World Hypertension Day. And this particular year, the theme for this year is measure your blood pressure accurately, control it, and live longer. And in light with this, we are bringing you this special edition on hypertension. I'm your host, Enoch, and we are here to unpack hypertension, also dubbed the silent killer, because it affects millions of lives worldwide. To help us unpack this topic on hypertension, we have in the studio today Dr. Josephat Chiripanyanga. He's a renowned family practitioner and with years of experience in managing family health. Welcome to the show, Dr. Joe.
Thank you so much, Enoch. It's a pleasure to be here with you.
Okay, so Dr. Joe, let's start with the basics. What exactly is hypertension and why is it dubbed the silent killer?
So Enoch, hypertension simply means high blood pressure. Most people, you hear them saying, Antine BP or I've got blood pressure. Technically, we say everyone has got blood pressure, but the problem comes when it's now elevated. That's what we now call hypertension. So for us to understand that, we need to talk a bit about the figures. So the normal blood pressure ranges, we say mainly we've got two BP readings, the top one and the bottom one. The top one, we call it the systolic blood pressure, and the bottom one, we call it the diastolic blood pressure. So the top one, or the systolic blood pressure, the normal range is usually between 100 and 140. 100 and 140, and then the bottom one, the diastolic one, is between 60 and 90. So anything greater than 90 on the bottom one and anything greater than 140 on the top one, that's now hypertension. So essentially that's what high blood pressure means. Simply put, it means the pressure with which blood is moving within your arteries. That's blood pressure. So if it's now higher than these ranges, it means the blood is moving at a pressure that is higher than what it's supposed to be. So it's now called the silent killer, mainly because hypertension, we say it's asymptomatic most of the times. What this means is you'll be having high blood pressure and you're walking and doing everything normally, yet your BP is high without you noticing. You don't have any symptoms. And to viewers out there, I need you to know, I see a lot of patients that come to me and they say, Doc, inini BP yangu ndinoinzwa yakwira. That's not true. There is no way you can tell when your blood pressure is high or normal. So that's why it's dubbed the silent killer. We lose patients with hypertension without them even knowing that they suffer from hypertension.
Wow, thank you for unpacking that. So it being such a universal concern, Dr. Joe, how prevalent is this condition globally? How prevalent is it maybe continentally, even at national level?
Yes, hypertension is a very common condition and it's a chronic condition. Once you're diagnosed with hypertension, it means you're going to suffer from hypertension for life. So that means everyone that has been diagnosed with hypertension, they are still patients of hypertension essentially for life. So we say the prevalence of hypertension is about 30% of adults being people from 19 years to about 79 years. 30% globally suffer from hypertension. But now it's good that you brought Africa and even Zimbabwe into the picture. When it comes to third world countries, Africa in particular, the prevalence is even higher. We say in third world countries in Africa, the prevalence goes to as high as 42%. Remember, we said globally the prevalence is up to about 30%. But in Africa, it goes all the way to 42%, which is the same as Zimbabwe. So the reason being poor socioeconomic statuses, they also predisposed to hypertension. Secondly, screening tests are not done as frequent as in other countries, and knowledge also is not that well disseminated in third world countries about hypertension compared to first world countries. So we see that hypertension affects more people in the third world countries. Here in Zimbabwe, our prevalence is also as high as 42%. And also the other thing is it also affects men more than women. There's a slight predisposition towards men compared to women. Maybe it's because you are the breadwinners, the pressure's always on us.
Yes. Alarming figures there. If you're talking of 46%,
yes.
Doc, I'm worried. What about awareness? Let's talk about awareness. Are people generally aware of the prevalence and also of those that are aware? What would you say? How many are in control of hypertension?
Awareness is there's a huge gap in awareness. It's a good thing that you're doing this Meditalk. Enoch, I really appreciate what you guys are doing. You're disseminating this information, and it's going to help a lot of people. People do not know about all this, and people are ignorant. Most people are ignorant, and particularly men. They also have this thing that they don't want to be tested. They don't want to go to the doctors. They don't even want to go to the pharmacy to get their blood pressure checked. People go about with this statement, "Tukachaga makudo mugomo no one." Yet you are saying, they're still going to cause harm. So we need people to be more aware. We need people to be more active and more proactive in terms of checking their blood pressure levels, even any other medical condition. At least once a year, you should go to your doctor, go to the pharmacy, get your blood pressure checked, get your annual medical checks done annually. That way it's going to help. So because of this lack of knowledge and ignorance, here in Africa, in Zimbabwe in particular, the prevalence of people, we say it is up to about 42%.
Yes.
That are hypertensive. Of the 42%, only about 20% know that they are hypertensive. Of the 20% that know that, which means 50% of the people, they don't know, more than 50%. And of those 20% that know, only about 10% are well controlled. That means their BPs are within the normal ranges that I spoke about, the top one between 100 and 140, and the bottom one between 60 and 90. Most people are moving around with high blood pressure without even knowing that they've got it. And the second group of people, they do know, but they are not keen on taking medication. And those that are taking, they are not even proactive. They are taking and skipping and not taking it religiously. So that's the challenge that we have. One, ignorance. People don't even know they've got hypertension. And two, people who know but are not actively participating in the management of their hypertension. And thirdly, people who know and are taking medication but are not taking it religiously.
Powerful points that you are bringing out, Doctor, in terms of knowledge first.
Yes.
Also awareness.
Yes.
And being able to control.
Exactly.
I also understand that hypertension can be influenced by risk factors.
Yes.
That emanate from lifestyle.
Yes.
Maybe help us to understand what are some of the main causes, what are some of the risk factors that can predispose one to hypertension.
So hypertension, essentially we've got two types of hypertension. There is the essential or primary hypertension, whereby we say the cause is really not known. Then there is secondary hypertension, which is whereby we say there is a known cause that is causing hypertension. That only affects about 5% of individuals. That's when we know the cause. For example, someone is diabetic, someone has got renal failure or other conditions, but the most important one is the idiopathic or essential hypertension, the one whereby we do not know the cause. That's 95%. And this one is mainly affected by the risk factors, your lifestyle, what you're doing. So most people lead a sedentary lifestyle. That's why they get hypertension. Sedentary lifestyle meaning people are not exercising, people are not eating healthy, people are not getting out of their offices. You drive, you get from home, you get into your car, which the garage is just 5 meters at most away from your door. You walk 5 meters, you get into your car, you drive, you get to your workplace, you get into an elevator, sit in your office, breakfast is brought in, you're eating while sitting, doing nothing, you go back home, you're on TV, no time for exercising and all that. So that's sedentary lifestyle. And these are things that are preventable. If you change your lifestyle, you can easily manage or prevent or minimize your chances of suffering from high blood pressure. So living a sedentary lifestyle is number one risk factor that affects most people. Secondly, smoking. If you're a smoker out there, we encourage you to stop smoking. If you stop smoking, you minimize the chance of suffering from hypertension by more than 50%. So people who are smokers, they've got a 50% plus risk of developing hypertension compared to people that are non-smokers. Then other risk factors also include dietary factors, eating a lot of salt. I've stayed with people that before they even taste their food, Enoch, they start eating salt.
So they say it's an African thing.
And that's why hypertension is more prevalent in Africa. So let's not do that. If you are about to eat, don't just add salt. In fact, we should have this culture of not putting table salt. We should not have salt on the table. So whatever salt is put in the food when the chef is cooking, that's enough. Don't add any salt. That's the rule that you should work with, because salt is one big risk factor. Secondly, fat. People are eating a lot of fatty foods, a lot of takeaways, deep fried foods. They are not healthy. They are not good for us because they're going to clog your arteries. Once the arteries are clogged, blood pressures go up. Then lastly, there is a family risk. If there is a family history of hypertension, your father, your mother, your uncle, your aunt, even grandparents were hypertensive, it means you're also at a higher risk of suffering from high blood pressure.
Thank you, Doctor, for shedding light with this discussion. I'm sure our viewers are gaining a lot in terms of insight and knowledge. So, Dr. Joe, common knowledge refers to primary hypertension, two types of hypertension actually.
Yes.
Primary hypertension and secondary hypertension.
Yes.
If you can take us through the pathogenesis of hypertension.
All right, so pathogenesis speak to how disease occur. How does someone get to suffer from a certain condition? What exactly is happening at cellular level, going all the way to the organs? So with hypertension, there are mainly two things that we talk about. What brings about your blood pressure is your heart initially. When the heart pumps out blood, there's pressure that is going to be generated. So that's the pressure that you record at the top. Is the pressure after the heart is contracted. That's why it's called systolic blood pressure, because the heart is in systole. Then the other pressure is the pressure when the blood is coming back. The bottom one is called the diastolic blood pressure. When the heart is in diastole, the heart is relaxed. So if the bottom one is very high, it's also a bad sign, because the heart is relaxed and you don't want your blood pressure to be high when the heart is relaxed. Then the second thing that we look at after the heart are the arteries. There is something that is called peripheral resistance. It's like when you're pushing, water is coming out. I always give this analog. Water is coming out of a tap and it's getting through a hose pipe. The hose pipe is representing the arteries. So if the hose pipe is big, the pressure is going to be low. If the hose pipe is narrow, the pressure is going to be up. So blood pressure occurs, high blood pressure occurs when your arteries are now narrow and they are stiff. Ideally, there is a phenomenon called vasodilatation and vasoconstriction. When your blood pressure goes up, your arteries should dilate, they open up. Then the blood pressure comes down. This is done through what is called autoregulation. You don't need to think about it, but your body just does that on its own. But when you are now suffering from high blood pressure, your arteries are now stiff. When they are stiff, they don't dilate. Pressure goes up, they remain stiff, they remain narrow. Therefore, the blood pressure goes up. That's how people develop high blood pressure. And on that note, Enoch, I need you to note that, and the viewers, please, the reason why that we say hypertension is a chronic or a permanent condition, that once you're diagnosed, you are most likely to be on medication for life. It's mainly because the damage that occurs on the arteries is permanent. There is no reverse to that damage, and there are no drugs that can be used to reverse that damage. So once the damage is done, it's permanent. The medications that we give you, they only bring down your blood pressure to work with your already damaged arteries. So please note that the damage is permanent, and therefore treatment has to be for life. So essentially, pathogenesis has to do with the heart. If the heart is pumping heavily, your blood pressure is going to go up, or it's also pumping fast. That's why some of the medications that we use, they slow down your heart rate so that we reduce the amount of cardiac output, the amount of blood that is coming out and getting into your arteries. And also the issue to do with the arteries themselves, peripheral resistance. If it's high, blood pressure also goes up.
Quite insightful. So, Doc, you started by mentioning that hypertension is often dubbed the silent killer.
Yes.
Because it is asymptomatic.
Yes.
But if it is asymptomatic, then how does one know that they have got hypertension? Are there any symptoms to refer to?
Yeah, that's a very important question, Enoch. To begin with, let's re-emphasize the point that hypertension is a silent killer. Initially, it's asymptomatic. That means you don't have any symptoms, no headache, nothing, and you can't tell that your blood pressure is high. And most of the cases we say hypertension is diagnosed incidentally. That means it's an incidental finding. You come to the doctor maybe for some medical checkup, then your blood pressure is high. Or maybe you're even taking your friend or your wife, your spouse to the hospital, and you just ask, I just check my blood pressure, and then be like, you're actually more sick than your spouse. We need to admit you. Then your spouse can actually go home, the one that you thought was more sick. So it happens. I've seen that. I've done that several times. So hypertension is asymptomatic. You can't tell. But symptoms generally start coming as it's progressing. And normally symptoms come when it's even worse. And the bad thing is some of the symptoms will come and they are permanent symptoms, or they give you permanent problems. So number one symptom that might have is headaches. And on that note, I also need you to know that hypertension affects you from head to toe. It doesn't affect single organs or one hand or only this part. No, it's from head to toe. So the symptoms are also from head to toe. So from the head, you can get headaches because of hypertension. If you're having chronic headaches that are not going away, it could be hypertension. Dizziness. You can't see properly, or the world is spinning, you're lying on your bed, things are spinning. It's also a sign of hypertension. You can have blurred vision, difficulties in seeing because the retina is now being affected by blood pressure. So hypertension can also cause you effects in your eyes. Sense of smell can be affected, even sense of taste can also be affected by high blood pressure. Then coming to the chest, you can have palpitations in the heart. Nothing has scared you, you haven't exercised, you're just seated, your heart starts pounding, just like that. Suspect it could be hypertension. So if your heart is beating too fast, unnecessarily, suspect it could be hypertension. When you go to the peripheries, the hands, the lower limbs, the legs, you can feel a numbness in the lower limbs or in the hands. Chiveve. You can't touch properly or you can't feel your hands, and at times you get pins and needles. That's also a sign of hypertension. Normally these are signs that show that it's now progressing, it's now affecting your nerves. Coming further to the abdomen, we can also have central chest pain because of hypertension.
Because of hypertension.
Yes, even left-sided chest pain, shoulder pain, that can also be related to the heart because of hypertension. Then to the abdomen, it can affect your kidneys, can have difficulties in terms of kidney function, passage of urine. Urine might be getting low and things like that because of hypertension. In your lower limbs as well, your feet might start to swell up. If you're having lower limb swelling, suspect it could be hypertension. And swelling can also be generalized. Hypertension can affect your heart, it can affect your liver, that can lead you to have abdominal swelling, ascites, facial swelling, and even anasaka, generalized body swelling. It's also common with hypertension.
Which means it could actually be difficult to pinpoint a symptom associated with hypertension.
Yes.
The best would be to adhere to the annual monitoring and checking that you're talking about.
Exactly. The symptoms are vague. If you look at them, headaches can get headaches from anything flus, yes. Anything can give you a headache, blurred vision, dizziness. All these symptoms are quite vague. It's not only hypertension. So the symptoms are not diagnostic. Unlike certain conditions like pneumonia, I can tell from the symptoms that this is pneumonia, or even asthma, or certain conditions, arthritis, you can tell from the symptoms. So the most important thing is to get checked. Always be in the habit of being checked at least once a year. Go to the doctor, go to the pharmacy, get your blood pressure checked. If you're a high-risk individual, say you're obese, you're a smoker, there's a family history, your father, your mother, or any of your relatives had hypertension, then it means you need to do these checks more frequently. And these BP machines are now fairly affordable. You can buy your own BP machine in any pharmacy, then you can use the BP machine on your own at home. Check your BP readings on a regular basis. You can even do it on a daily basis, especially if you're a high-risk individual.